Hi, I'm Dr. Roger Cady, a headache specialist at the Headache Care Center in Springfield, Missouri. And I'm here today to talk to you about a very interesting study we did looking at a combination of feverfew and ginger in the acute treatment of migraine. This study was conducted in 3 centers across the United States. One of them was in San Francisco, the second was in San Antonio, Texas, and the third site was here in Springfield, Missouri. What we did is called a double-blind placebo-controlled study. That means that people who were in the study did not know whether they received the active drug or they received a placebo. That would be a product that we really wouldn't think would have an effect in migraine. And also, the physicians who were conducting the study and the nurses did not know which of those products an individual was done. This is kind of a classic design used in headache research for almost all products today. Individuals included in this study were men or women ages 12 to 60. That's somewhat unique because very often we do studies just in adults, but in this particular study we looked at adolescents. And this is an important group because many adolescents suffer with migraine. What we used in this product was a sublingual gel. And this is kind of unique because most migraine medicine, as everyone knows, are tablets. And that can be problematic in the sense that if somebody's nauseated or if they vomited and they take a tablet, it's not going to be absorbed very well and may in fact just sit in the stomach when it needs to get into the bloodstream. In this particular case, this gel was placed under the tongue and it absorbs into the bloodstream through the tongue itself. And this is a very unique way of absorbing medication and has important application to a disease like migraine. The patients were instructed to take the medication when the headache was just beginning or was hopefully, ideally, the pain was still mild. And this is important because that parallels the way we try to get people to use medication to treat migraine in real life. It's what's called early intervention. And we know that if we do this, we get better treatment results, and also we shorten the time that a person is actually experiencing a disabling migraine. So in this study, we selected a group of patients who, for the most part, had a period of headache that they called mild, but that they would know if they didn't treat this, it would go on to become moderate or severe or a full-blown migraine. And they were instructed to take the medication when the pain was mild. Now, not everyone could do this, of course, and we didn't exclude people that went on and took this when it was moderate to severe. We looked at all the people in the study. And what we found is that at 2 hours after they took their dose of medicine, 32% were absolutely pain-free compared to only 16% who took the placebo. Then, if we looked at those individuals who really had no pain or only mild pain at 2 hours, that went up to 64% for the active group compared to only 39% for the placebo. Well, as anybody who lives with migraine knows, migraine is always more than just a headache. There are many symptoms that associate with migraine, such as nausea, light and sound sensitivity. Headaches are typically made worse with activity. They tend to be throbbing and pulsatile in their character. And so we want to look and see what happens to those types of symptoms when people treat their migraine. And in this study, what we found is the pain, which is usually pulsatile, became non-pulsatile for the most part. We also found that there was less worsening with physical activity, and we saw resolution of light and sound sensitivity, very important associated symptoms. Whenever we do a study of a medication, we always look for adverse events, or what people commonly refer to as side effects. And the way we do this is we capture any type of negative symptom that a person might experience, whether we think it's related to the drug or not. And then we compare it to the people in the placebo group and see which of those side effects were more common in the active group versus the placebo group. In this population, we concluded that the combination of feverfew and ginger, taken sublingually or under the tongue, was safe and effective in the treatment of migraine. We found that the product was very well tolerated and there were no contraindications or reasons that this product could not be utilized with other migraine medicines.